Hi, you guys. I've lived in Nashville for umpty-gumpty years. That means more than 20. And I have never had cable television. I don't even watch TV. I've never subscribed to the newspaper because I'm such a bookworm that everything else just falls behind. But still, I heard about him when he hit town. Now, you know, when you get that kind of buzz, that'll tell you something. So, to tell you a couple things, I'm 67, and I not only have bionic eyes, but I have a bionic hip and, and a pacemaker. So, you know, I've got all kinds of extra parts and pieces that I didn't have before, and I'm grateful for them. But I spent, first of all, I work at the VA, and I am a veteran. And proud to be a veteran, proud to have served my country. Thank you. And because I am a veteran and I work at the VA, I could get cataract surgery for $0. Well, that would have been the old kind of cataract surgery. So it would have improved my distance vision, but it would not have improved my reading vision. And there was nothing that that they could do to improve either of my visions without just doing the old standard kind of cataract surgery. So I knew about Dr. Wang, and so like I say, I just had the buzz about him when he hit town. I don't know how that happens, but it does. And so I called, I made an appointment, I came in. You know, when you talk about scrimping on stuff, he does not scrimp on any of his equipment. When you walk back down here, see those gray glass door windows there? Through there you'll see arrays of equipment. I mean, just arrays of equipment, and they use all of it on you. And I like that. You're going to find out, if you haven't already, from some of the literature you've gotten or from being online, that this man is well educated. So I'm not going to beat that drum. He has invented and patented, holds patents on several eye procedures that have never been done before. I like somebody who sees a challenge and says, let's take it on. You know, I like that. I like that kind of enthusiasm and dedication. He's also written 6 textbooks on eye surgery. And you know about his charity work. You guys know he does the eyeball, and that's to raise money for his foundation that brings people to Nashville who have severe, mostly blind, corneal blind, and he waives his surgical fees, but the foundation raises the money for their transportation and for them to have housing while they're here and for when they're, you know, in the hospital. That's all good stuff. And then, you know, I'm kind of critical. I've been around a while, and I've been, you know, I like things, when I go in, I kind of case the joint. So right off the bat, I like the staff. They're professional, they're friendly, they're doing their jobs, they're paying attention to what they're supposed to do. Because it's not a one-man show. It's him and everybody else that works for him and works with him. And Patty Kidd is his cataract coordinator, and I'll tell you more about her in a minute. Another thing, you can't really tell right now because there's so many in here, so many of us in here, but this waiting area is really designed to be comfortable. He's got a soda pop fountain and coffee and tea station over there. He didn't have to do that. He's got these big loungers. He didn't have to do that. So what that tells me is that he cares about every aspect of our experience here with him. Not just the surgery and not just any one part of it, but the whole experience. So I started talking to other patients, and I started seeing other patients. You guys have probably heard about his celebrity patients. That's true. These people can go anywhere. So why do they go to Dr. Wang? Well, if you don't know now, you're going to be lucky if you do get to find out. I'm not being any more specific than that because I think everybody else has kind of covered the field on that. But when I was here the first time, I started talking to a man that was from California. And I don't know what was wrong with his vision, but California is a pretty big state. And they've got some, you know, kind of like educational kind of places there and a gob of doctors. But his doctor referred him from California to come to Nashville to see Dr. Wang. That says something to me. They did that because it was important to them, whether you're a celebrity or whether you're just a regular person like me and like the guy I was telling you about. There's something worth coming here for that you cannot count on anywhere else, and you can count on it here. I couldn't find fault with any of these people, and I was looking. But I'm also the kind of person who doesn't jump into something, so even after I had the consult, I started checking out other things. And I didn't like what I was finding out. And then my best friend who lives in Franklin, and Franklin's kind of a hoity-toity area, and they've got nice doctors and things. She had a cataract surgery there. The doctor made a mistake. She's blind in that eye now. And she's terrified to get the other cataract done because she's terrified that something will happen. You know, and I've told her about Dr. Wang, and hopefully at some point she'll come. But for me, you know, I'm a person of meager means. If you work for the VA, you ain't going to get rich quick. But it was worth it for me to come here for what I could get that was going to not just improve my vision, but improve the quality of my life. And that's a big deal. I called, in fact, I had already been set up for the surgery of Patty Kidd, the cataract coordinator called me and said, you know, asked me if I was ready to schedule surgery. And I said, well, I thought I'd just check out some of my options. And she said, you know, that's just fine, but just be sure you ask them how many cataract surgeries they have done. This man right here, more than 25,000 LASIK and cataract surgeries in 50 countries and something like 44 states in the United States, and 3,000 of those were on other doctors. Now, when the doctors come to this guy, that will tell you something. Actions speak louder than words. Anyway, I came back here, and the first question I ask is, who's going to do my surgery? Do I get Dr. Wang? Yes, if you want Dr. Wang, you're going to get Dr. Wang. So that meant a lot to me, too, because over at the VA, I wouldn't have known who was going to do my surgery. It could have been a resident, and it could have been the first time that they were doing that. So I took a long way around to making the decision, but that's just the way that I process things. And I'm glad that you guys are here and that you guys are processing stuff too. So way to go, team.